that presents a risk for health. Yes. So when we look at obesity, that describes as a disease process which starts and can be a problem at a low BMI. This is underlying disease process driving type 2 diabetes. Obesity as a disease is not merely a state of having high BMI or a large waist circumference by itself, because it relates to type 2 diabetes. So endocrine, nutritional, and metabolic diseases are all classified into ICD 11.5. So it has been considered to be multifactorial, as all of us know, because it takes, so many factors. As a cumulative thing, you find it as obesity or positive energy balance. That is when the dietary energy intake exceeds energy expenditure. And that relates to my statement of sedentary life. Obviously, the intake is higher than the energy that is used for the exercise or other regular routine. Because during lockdown, I can tell you predominantly people were sitting in front of the system for at least 10 to 12 hours. So globally, when you look at obesity, 1.6 billion people are overweight and 600 million are obese. And by 2025, there is going to be a tremendous increase of about 7% in men and about 6% in women. So how do we relate this global issue? In each country, you find there is a huge percentage of people being obese. That's about more than 20%. In US, it's more than 30%. In India, it is just 2.3%. Thanks, the percentage looks small, but the number is so huge because of our population. It's 135 millions in India are obese. And when we look at the definition for obesity, which is recognized as a chronic disease, the American Medical Association, defines it as an urgent health problem, and to increase the treatment opportunities and insurance coverage. This has become a problem in hand which needs to be addressed. And UK Endocrine Society, they tell us that obesity is a disease based on current scientific evidence and how it relates to other disease conditions. And European guidelines urge the physicians to recognize obesity as a disease and provide appropriate prevention and treatment. So whenever we talk about obesity, how do we classify it? BMI becomes a very simple tool that we use in day-to-day to screen the patients for overweight and obesity. Weight in kg by height in meter square. All of us know this. And this classification of obesity as underweight, normal weight, this is a international classification. So where we find about 25 BMI, we call them overweight. But if it is an Asian Indian classification, we find that 23 and above becomes overweight. So mind you, we fall in this category, not in the international category. So we need to treat our patients in this classification. And BMI entails kilogram and meters, squaring and dividing it. All of us know that. But there is a drawback in that because it doesn't directly relate to your body fat as such, but waist circumference, which is really easy for a lay person to measure. The measurement reasonably is accurate and matches the clothes, waist size. Easier to understand, and it means something to people, right? Because it is easy to measure, and it indicates body fat and indicates accumulation of intra-abdominal ectopic fat and relates to health risk, especially in patients whose BMI is not very high. So this is how you measure. Easily understood alternate of BMI. Midway between lower rib and iliac crust, tape should be horizontal, and it reflects total body fat and also intra-abdominal fat. When the body fat and BMI are very similar, the waist circumference indicates variation in the intra-abdominal fat mass. And when the body fat and BMI vary widely, then waist circumference indicates variation in the total body fat. And waist circumference as such correlates with the abdominal fat that is present. You do find as the waist circumference increases, abdominal fat is also increasing. But intra-abdominal fat mass expands with total body fat, obviously, and also with age. As age increases also, abdominal fat deposition and overall total body fat increases. And what are the causes? All of us know that the causes are multifactorial. It could be food inactivity, genetic, environmental, behavioral, and medications that people are advised. It could be steroids, which can be a causative factor, or it could be endocrine diseases like thyroid, PCOS, Cushing's syndrome. All these conditions can also lead to obesity. And this is a mechanism of developing obesity and overweight. Long-term excessive energy intake, all of us know this, because if you are eating 100 calories above your requirement on a daily basis over a period of 1 year, I can tell you, you will increase about 10 pounds. Excess lipids, especially triglycerides, gets deposited in skeletal muscles, liver. Basically, fatty liver is a common thing that we see among overweight and obese patients, and stored primarily in the subcutaneous adipose tissue, which differs in their metabolic and physiological characteristic. Adipocytes start increasing in number and in size. Tissue remodeling occurs, and number of inflammatory mediators like the macrophages and cytokines are also released. A low-grade systemic inflammatory state occurs, especially when people are obese. So what happens? It affects all over the body. The obesity as such, it relates to every organ in your system. Say for example, psychological impact, it leads to depression, poor self-image, eating disorders, poor quality of life, neurologically stroke, dementia, cardiovascular, atherosclerosis, heart failure, GI. When we talk about GI, NAFLD, that is non-alcoholic fatty liver disease, is on the increase. Anybody who undergoes a master health checkup, I tell you, we see a lot of people with NAFLD. Maybe they don't even understand what it is, but grade 1 will be there. If they don't act at that time, it's going to progress. So cirrhosis, hernia, GERD, all these are common. Even cancers like colorectal, liver, gallbladder, and metabolic. When we talk about metabolic disorders, type 2 diabetes, insulin resistance, metabolic syndrome, it is common among obese people. So how do we advocate weight loss for obese people? What is the benefit for them? Because if you advocate 5% weight loss, 10% and 15%, you do find beautiful change in their overall well-being. You do find that adipose tissue insulin sensitivity improves with weight loss, liver insulin sensitivity, intrahepatic triglyceride content, muscle insulin sensitivity, beta cell function. All of us know when they reduce weight, obviously, reversal of diabetes is possible. That is why there's a lot of encouragement in the initial or pre-diabetic or newly diagnosed diabetic people to reduce at least 10% of their weight in order to have a better beta cell function. And adipose tissue biology and inflammatory markers, as we discussed just now, inflammation comes down, obviously the well-being of the patient is better, and free fatty acid also comes down. So when we have weight loss implemented for the patient, the benefits that they can reap is that they have a better quality of life, self-image improves, sleep apnea improves, PCOS improves, the risk of cancer is reduced, and metabolic disorders like prevention of type 2 diabetes, improvement in their glycemic control, and reduction in their blood plasma insulin, and insulin sensitivity improves, as well as musculoskeletal improvement. There is improvement in frailty when you lose weight. Obviously, sarcopenia is part of obesity. So if their muscle strength improves, obviously there is improvement in frailty. Weight loss helps them to improve on their atherosclerosis also, right? They'll be able to move freely. So what are the current therapies that are available? One is nutrition therapy. Next is pharmacotherapy.